Hi, I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Practice, where lives are changed every day through the natural approach to healthcare. Today we're talking about scleroderma, and it is Scleroderma Awareness Month.
Mm-hmm.
You know, there's a month and a day for everything.
Yes.
Last week it was Donut Day. Did you know that? How did I miss that? So probably, what are you going to say?
Well, it's interestingly enough, this is for June, it's the only, most months have several diseases. June only has scleroderma.
June only has scleroderma.
Yes, it's
and most
unusual.
of us listening don't know what it is. So
That's
good thing
why
we're
we
having
need to be
awareness.
Yes.
But you say you have a lot of patients that come in with it.
We do.
And don't know even what it is.
Correct.
And that they have it. So let's talk about that. Dr. Prather, what is scleroderma?
Well, sclerosis means hardness, and derma means the skin. So this was a disease that was first recorded back in the Greek days, Hippocrates. So it's been around for quite a while, been a condition that people have been aware of. It is not just the skin, though. Mm-hmm. But the common thing that they would see in ancient days, or even nowadays, is that the skin would actually harden. So there was a hard place. Mm-hmm. But really, what you're talking about in scleroderma, it's an abnormal growth of connective tissue.
Okay.
So
can that be fatal? Can scleroderma be fatal?
It can. There are different types of scleroderma, and one of the kinds is systemic scleroderma, which can be extremely fatal. Matter of fact, trying to help people to live, 5 years longer, 10 years longer is one of the major things that you do in that type of situation. So it can be something that can cause fatality, especially if it goes to the heart and lungs and kidneys. So it can be a very serious problem.
And that's, you said, when it's systemic.
When it's
it
systemic.
Goes systemic. Well, how common is scleroderma?
Well, when you're talking about the systemic kind, the kind that's fatal, there's about 49,000 people who are diagnosed with systemic scleroderma in the United States. So but when you're talking about the more localized, where it's not a fatal type of disease, they don't know how many people. But from my judgment, it's very much underdiagnosed, because I get an awful lot of people who have scleroderma in my practice, which is understandable. If you're talking about ligaments, tendons, connective tissue, hardening, then people are going to be in pain in that type of situation. Oftentimes it is not responsive to most medical treatments or even most common chiropractic treatments. So people in that type of situation are looking for someone who can help with their pain, their problems, and it's not really that well diagnosed. So, as I get them at that point, then I can recognize that this is a scleroderma type of situation where their connective tissue is hardening, thickening, and causing abnormal motion and abnormal pain, and then treating it appropriately and getting the results that are necessary. But it's, as I said, much more common than what people realize.
Right. And it must be because they're creating awareness, of it.
Yes, and it's a very underdiagnosed type of condition. That's
but
why
you see it a lot in your office.
I see a lot in my office.
Okay. So. Well, what are the different types of scleroderma?
Well, you have you divide that up first off on localized or systemic. Is this a systemic problem, which is what we would consider life-threatening? That's easier to diagnose because of all the different types of things that are occurring. It's sort of a cascade of issues that are happening. So, but localized, people can just think that that's just a local patch that on their skin that could be a problem. Some people even when it's linear, call them like stretch marks.
Oh, okay.
Okay.
So what do they feel like, or what do they look like?
It's a discoloration on the skin.
Okay.
And it's a hardened area. In other words, the skin texture has changed. It's no longer skin, but it looks like what oftentimes people might call them stretch marks, or a little patch of something that they don't really understand what's going on.
Can it be real small?
They can be real small. They can be big. It can vary quite a bit according to the condition.
But the skin will look different.
But it's not just the skin. You can also have that in joints, because it can be in cartilage. It can also be in tendons, ligaments, fascial material. Can also be involved in that. So you can be, and oftentimes they'll call it different diseases according to the location. So it could be in the esophagus. And if you have esophagus scleroderma, then you have gastric reflux. You have difficulty swallowing. It can be in the heart, which is serious, where it can cause abnormality, where you can get some cardiac failure.
Okay, so I'm trying to understand it, so it's just not in the skin,
it's
not external. It can be internal.
Internal also. One of the things that I see it very commonly is post-surgical failure is what they call it. Where, you have a surgery, and because the area has been disturbed, the surgery appears to have been a success. It should have been all okay, but then all of a sudden the body reacts to the ligaments, tendons that have been damaged in that area from the surgery, and they start to thicken, and you start to get fibrous material in there, which is really a scleroderma autoimmune reaction. And that's one of the big things, is scleroderma is an autoimmune disease.
And what does that mean?
That means that the reason that the connective tissue is thickening is because the body immune system is attacking that area. And it picks out different areas, usually because of trauma or weakness. In other words, there's some reason why that area is being picked on. Overuse. So you can have scleroderma in the elbow, where it can be causing because the body's actually attacking it. Hey, people come in, I've had patients come in and said, my elbow just started to hurt. Some people actually have some scleroderma in the knee. So it's an overuse type of thing. The body's not quite working correctly, and the tendons and the ligaments all of a sudden just inflame, and you get some excruciating pain in that area, where the body's actually attacking that, and the person isn't aware of why that's occurring.
So there could be pain come with it.
Usually pain is one of the things that people are complaining about.
Okay.
It can get into the jaw. It can get into the dental structure. It can go anywhere that there's connective tissue, and there's connective tissue everywhere.
Everywhere in our body.
Everywhere in the body. But it's kicked up, and it is an autoimmune disease. Now, it can also be in connective tissue in the arteries or the veins. Raynaud's disease, which is an autoimmune reaction, usually kicked off by stress or by cold. And it's a constriction of the arteries in the extremities, but that is actually a scleroderma disease.
Okay, so there's like a classification, and then
quite a few different things that occur along those lines. And probably the most common thing that we see is a post-surgical situation where the surgery actually was done correctly and working out well, but the body will then have an autoimmune reaction around that traumatized area, and all the connective tissue will start to thicken, tighten up, and cause dysfunction, pain, and swelling.
Interesting. So what causes scleroderma?
Scleroderma is usually kicked off by some type of a autoimmune where the body's attacking it. There is some genetic predispositions along those lines. There is very commonly hormonal issues that are off. There are environmental issues if you have heavy metal toxicities, if you have had certain types of exposures, if you have allergies, you're more likely to get scleroderma. If you have a poor diet, poor nutrition, that also leads to a greater possibility of scleroderma. And gut issues are very commonly, because the gut is so much involved with the immune system, that gut infections, gut deficiencies, things like that can really be something that can be a precursor to scleroderma. So pharmaceuticals, taking different types of pharmaceuticals can kick that off too.
Interesting. When we come back, let's talk about who gets scleroderma. You can win a free 60-minute massage in a relaxing spa at the Prather practice. Each month, we have a drawing to give away a free massage to one of our lucky Facebook and Twitter fans. Follow us on Facebook and Twitter on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather practice. Dr. Prather, there was a major study by an insurance company that focused on the healthcare model you use in your office. What were the results of that study?
It actually was quite a seismic finding. I like that term.
Yeah.
Blue Cross Blue Shield of Illinois. It's a Chicago-based health maintenance organization. The group has 600,000 enrolled members. So they took about 10,000 of those and put them in with chiropractors who are trained in the structure-function model. Now, not all chiropractors are trained in the structure-function model. These gentlemen actually got the same type of training that I had. And they were the primary care physicians. After 5 years, they had startling results. They had a reduction of 60.2% in hospital admissions.
Wow.
They had 59% reduction in hospital days. They had a 62% reduction in outpatient surgeries and procedures, and a remarkable 85% reduction in pharmaceutical costs.
Wow.
This resulted in a total savings in the first 5 years of 40% over all the other primary care physicians.
40%.
40% reduction. If you can imagine that we could reduce our healthcare costs across the board by 40%.
And get those kind of results.
And there were 80% less reactions. There was a reduction in lawsuits. There was a reduction in everything. Plus, the people were much, much healthier and much more satisfied. The interesting thing is that the specialists, the cardiologist, the oncologist, the gastroenterologist, all the specialists, as they were asked to rate the difference in the two different models, they gave the structure-function model as the primary care coming in a 96% satisfaction rating, and they gave the disease model as primary care a 40%. The results are indisputable.
Schedule your appointment at the Prather practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather practice, restoring hope. You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, the most comprehensive wellness center in the Midwest. We're talking today about scleroderma, and this is Scleroderma Awareness Month. And I'm going to spell that because...
Scleroderma?
Scleroderma. And you said sclera means hardening.
Hardening.
Like hardening.
Sclerotic.
Yes. And derma, skin.
Skin.
Okay, but it's not only external, it can be internal.
Sure.
And affect the internal organs, correct?
Sure. And of course, it was named back in the days when they weren't aware of the internal issues that are involved in that. But as we said, it's a body attacking and thickening and hardening the connective tissue. And then it causes dysfunction, pain throughout the body at that point.
It kind of reminds me, so everything's like tightening up. It's like rigor mortis?
Yes, tightening and thickening.
Interesting. So who gets scleroderma?
Women are more likely to get scleroderma than
I don't like
men.
that answer. Change your answer.
Now, the reason is because hormones seem to be playing a very big role.
Those darn hormones.
And women, some people say women have more trouble with hormones than men.
Yes, I think.
I don't know who says that, but that is a very common type of thing.
We don't need the scientific proof to.
But everybody can get scleroderma. So babies can get scleroderma, men can get scleroderma, but it's more common in women, so that's why they feel that there's a hormonal relationship along those lines. For the localized scleroderma, it's more common in women of European descent. Systemic scleroderma, the dangerous one, is more common in African American women.
Interesting. Why is that?
They think that there's a genetic component in that, but we don't know for sure.
And you say this is an autoimmune disease, autoimmune reaction.
Yes.
So how is it diagnosed?
Well, that's the tricky part. And that's why it's not as well diagnosed as it should be. There isn't just a blood test for it. You kind of have to play with it and see certain signs that yes, the immune system, there is an autoimmune reaction occurring, and then you have to correlate that with the findings, the exam findings. So first you have to determine that there's an autoimmune reaction, which is determined by the blood tests, and then you have to correlate that with the examination of thickening of the connective tissue, and then you put those things together, and then you get a diagnosis. So many people aren't diagnosed that is what's going on. Oftentimes they aren't treated properly because of that. And so there is one of the things is having the awareness is for the public, but also the awareness is for doctors to be more aware, because according to the institutes that study, educate on scleroderma, is that there is a definite underdiagnosing of the problem, and so therefore people aren't getting the proper treatments. So, as a matter of fact, the estimate is about 80% of the people are not diagnosed with scleroderma.
Interesting.
That have it.
So what diagnostic tests should be performed for scleroderma?
Well, first off, as you're trying to determine whether the scleroderma is occurring, is you definitely have to check autoimmune reactions, so doing those proper blood tests. You also need to do a complete thorough, if that is going on, that can occur throughout the entire body. So you need a very complete, comprehensive type of blood work.
Okay. You're talking about an autoimmune profile?
You have to do autoimmune profile plus all the other diagnostics that are involved with that. You also have to check for underlying heavy metals. You have to check out gut health. You have to check out the immune system. You have to check out allergies. In other words, once scleroderma has been determined as an issue, you have to check somebody from head to toe. Cardiac function, lung function, all those different types of things, because it could be occurring and causing damage throughout the entire system. So, a very common thing that I get is, I was just thinking about one patient. He had 3 surgeries on his low back. And each surgery he got worse. And the surgeons were like, we keep on trying to fix this, and every time we go in there, the patient gets worse. And these are good surgeons, they're doing the surgeries properly. Mm-hmm. Well, what was happening was he was having an autoimmune reaction in the connective tissue in the low back where the surgeries were coming. And the more you messed with it, the worse it got, because the body didn't like that. So the body says, hey, we've got some trauma here. There must be some type of infection or something going on. So we're going to hit it really hard. So one of the things that they did was they gave him steroids, to take. And steroids weaken the immune system, which a weakened immune system is why the body was attacking it in the first place, because all autoimmune diseases are kicked off by a weakened immune system. So the patient got worse. Went on opioids, which also makes with scleroderma, opioids increase the pain, don't decrease the pain. So then they were increasing the pain level. So everything that they were doing on this guy was making the whole problem much, much worse. And I was actually, as I was reviewing the records, think that he actually started out with scleroderma in the low back. And it wasn't a surgical condition, it was an autoimmune condition. And so they started out on the wrong foot. That's why the awareness needs to be there.
The awareness, the proper diagnostics.
Correct.
You're kind of like a detective.
Correct. Because if someone has scleroderma, the last thing that you can do on them is do surgery, because surgery makes scleroderma worse.
Well, as you're talking about it, I'm like picturing scleroderma saying, hey, you're messing with me. I'm going to harden around you to protect you.
Correct.
Okay, that's my layman's terms.
That's basically it.
Okay.
And that's a great way to think about it. So this guy was just down on a course, and it was to the point that he was thinking about suicide. Oh. Because every time a doctor touched him, he got worse. And so his wife brought him in, and he was looking at me like I was the enemy. Because every doctor
she dragged him in?
She basically dragged him in, and he had a scowl on his face when he arrived. He was just like, keep me away from docs. Because every time I go to a doctor...
Take your white coat off?
Yeah, right. Every time I go to a doctor, I get worse. And
can't blame them.
Right. And, I felt the back, and I could feel the scleroderma, going on in that connective tissue in that low back. It was just hard as a rock.
And you could, because you were trained.
Right.
Not all doctors are going to feel that.
Sure. One of the things I do is I look at the surgical scar, because I have people coming in with failed back surgeries. Or failed knees, all those different types of things. And I look at the scar. And if that's raised up, in other words, if that is not a good scar, then they probably have scleroderma, because the body's reacting to it. And, where they had done the surgery, it was raised up a good inch.
Oh, my gosh.
So, and the surgery had been 5 years ago. So it was not a normal type of situation at all.
So you got scar tissue.
You got scar tissue. Yeah, you've got an autoimmune reaction in the back. And so I let him know that this was something that, we needed to treat directly, but we also had to treat it internally. In other words, this was an autoimmune reaction. So, we did acupuncture, by the way, is one of the most amazing types of treatments for scleroderma. We're not quite sure why it reacts so well, but it does.
Do you put the needles too right on the scar?
We put it right on the scar, and we see quite a few changes. But that is one thing that has been well documented, and something that I've seen certainly in my office, that acupuncture is absolutely wonderful. Heart adjusting. Where you would be doing any type of twisting. He had found out that he didn't know I was a chiropractor until they brought him in, because he had gone to 2 chiropractors. And with scleroderma, you can't twist a joint because it just rebounds into even a harder position. So it took him, last time he had been to a chiropractor where somebody had really tried to mobilize that joint, because he said, wow, that's really stiff, let me mobilize it, which would make sense. But if you try to stretch it out that way, any type of forceful manner, it is not good. So he really...
He came in with a skull, then he finds out you're a chiropractor.
If he had had a gun, I think he would have pulled it on me right then.
Don't say that.
But just to keep me away. But I told him that, well, this is scleroderma. We have to really approach this from a totally different type of aspect. What you do is you do a ligamentous release and then a pumping of the sacrum, especially in the low back. And so there are very specialized type of chiropractic adjustments for that, but it has to be a very gentle reflex type of adjustment. And it's quite dramatic. I mean, on the first adjustment, first I did acupuncture because he was going to let me, and he goes, because he didn't think I was going to really hurt him with the acupuncture, because I showed him the needles and everything. And he got up and he says, "I feel better." Okay, this is the first time I've ever walked into a doctor's office. I left feeling better. And so after 3 acupuncture treatments, I convinced him to let me also start working in a, as I said, a reflex ligamentous adjustment, which works very well in this type of situation. And I did that, and then he got up and he says, "I really feel better." So then I started to build some trust. We were able to get him where, now he wasn't completely cured, but we had him 80%, because he's stopped in again, but we had him 80% cleared of his pain. He could live with that. He was just like, he says, "Just to let you know, I was pretty skeptical of you." And I said,
"That's
no."
not the first time you've heard that.
No, I couldn't tell. But you see, I understood what was happening.
Right.
And if I didn't have the diagnostic skills, if I didn't understand the situation, if I was not aware of scleroderma and the reactions that occur on that, then I would have been not treating this guy properly, and I wouldn't have gotten the results.
Well, and you not only have the diagnostic ability, you have the treatment, and a non-invasive treatment.
Yes. That really helps with scleroderma.
Yeah, which is so exciting, to help people that way. When we come back, more on scleroderma. Listen to the Voice of Health radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
Went to the doctor. She goes, "Did you know you're allergic to wheat?" I did not know that. She said, "Do you eat a lot of gluten?" I don't know what gluten is, but yes, I would say yes. I think I'm mostly gluten, to be honest with you. I don't know. And she gave me a book of things that have gluten in it. You know what has gluten in it? Everything! I said, check again. Maybe it's just cancer. I didn't take it well. Have you tried gluten-free stuff? It needs gluten.
A special message from the DTS Weight Loss Center at the Prather Practice.
Are you tired of making the same weight loss resolution only to end up right back where you started? Let the professionals at DTS Weight Loss Center take all the frustration out of dieting. Our nutritionists and wellness coaches know what works for every body type and can develop a plan specific to your needs throughout your medically supervised program. Make the change by visiting us online at dtsweightlosscenter.com. Dedicate, transform, succeed.
When you call the Prather Practice to schedule your appointment at our DTS Weight Loss Center, mention the Voice of Health radio show and you'll receive a free initial consultation plus a free body composition analysis. 317-848-8048. That's 317-848-8048. The DTS Weight Loss Center at the Prather Practice. Dedicate, transform, succeed. I'm I'm Lisa Prather, and you're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where we get to the root cause of your health issue. We're talking today about scleroderma, and I am learning a lot, as always. It is Scleroderma Awareness Month, and Dr. Prather, you just finished telling a story of someone that came in, and you say it's misdiagnosed quite a bit.
It is.
But you see it a lot in your office.
I do.
With your background as a chiropractic and pulpating, you can...
That's, as I said, really the way to find out whether someone has scleroderma is palpation. Because then you can feel the fibrous material underneath. If you don't do that, then it doesn't work that well.
And I know you did your own personal training in chiropractic school.
Yes.
With a phone book, a very thick Atlanta, Georgia phone book.
Sure.
Where you put a piece of hair in there.
Right.
And you worked on training yourself to feel it through the pages.
Actually, I was trained by Joe Maynard. He
And
was
who's
a
that?
professor there. He was an author, an amazing chiropractor, extremely well known. But he was the professor of philosophy. And as I went in, he was lecturing in the first quarter that I was there. And he said, there are an awful lot of techniques. There's a lot of ways of getting really good at it. And you can get very good at every single technique. But you have to be able to get feedback on whether it's working or not. And palpation is the key to good chiropractic, which is absolutely true. You have to be able to touch the body. You have to be able to feel what's going on. And so he said he was willing to train people in palpation if they were willing to do that. So I signed up and started my training with Joe Maynard on being able to palpate. And one of the things he had us do was he had us put a hair in the phone book and then have to be able to draw it on the outside of the Atlanta phone book.
Wow.
And see how thick you could get it, and then he would open it up and see if you had it or not. So you graduated when, and the phone book was about 6-8 inches deep, because he says that's how far you need to be able to palpate. And so about 8 inches on that, when I got to that point and could draw the hair, I graduated. Wow.
And I am so thankful that you're a good pulpator as your wife. Okay, well, let's talk about diagnostics. You talked about blood work and the importance of it, and it doesn't have a specific test.
Right. First, you need to do an autoimmune panel to show up stresses along those lines, so you can differentiate on what types of autoimmune diseases is going on. There's not a specific pattern, but you can eliminate some of the other possibilities, and then have an idea if that's where the scleroderma. But once you've identified that there's an autoimmune reaction, you need to do thorough blood work for the entire body. Obviously, you need to check out the immune system, see how that's stressed out, and different types of patterns on the immune system show up different types of where the problem is. So very, very helpful along those lines. You need to check out the function of the liver, kidneys, because the connective tissue can affect every single organ in the body. So being extremely thorough, and that's one of the things that we find, is that people are, within healthcare, there's a categorization. You got the pulmonologist, you got the cardiologist, you've got the, every single person has their own specialty, and they don't really check on the whole function of the body. And with scleroderma, you have to be very, very thorough, because this could affect every single organ of the body. So running through the entire system along those lines is critical.
We're not doing that in healthcare, though.
No.
We do that in our model, structure-function model.
Correct.
Yeah.
And that's why we need to really promote the structure-function, because we look at things in a holistic manner.
And this sounds like when you're dealing with connective tissue, you're dealing with
everything.
The whole, like you said, you're looking at them head to toe.
And hormones. Remember, we talked about the hormones being a very big factor. Hormones. And hormones are very much involved, and we get some amazing relief once we can get the hormones working properly.
Okay, let's talk about, you also talked about heavy metals, the trace minerals that you find out through hair analysis. Why should that be done?
Well, one of the things that can really kick off scleroderma is mercury, lead, or nickel toxicity. So being aware of those things, also copper zinc ratio plays a very big role in that, magnesium levels, and the best way to find out tissue minerals, not blood minerals, because you also do a blood mineral check along those lines. But tissue minerals, the best way to do that is a hair analysis. You can also do nails, to also find out tissue minerals. But it will show up whether lead, mercury, nickel, copper zinc ratios are causing a disturbance in the connective tissue. And that can definitely be an issue. One of our favorite way of doing that is a hair analysis, because it is something that's very well accepted. It doesn't give really false positives along those lines, and is a very well accepted means of finding out if that's an issue.
Very affordable.
Very affordable.
Insurance doesn't cover it, but it's $110.
Sure.
Well worth it. I know for someone, I deal with the imbalances in zinc and copper, so
Right.
that's been very helpful for me.
And that sets you up for a higher possibility of scleroderma too.
We talk about the gut health, how important that is. How important is it for scleroderma?
Well, the National Institute of Health has been doing a tremendous amount of research on the biogenome of the gut and its importance with immune system. And they are very excited, especially with autoimmune diseases, as one of the keys to getting things fixed. So looking at the gut is absolutely critical, and oftentimes what we find is some infection in the gut from that. So trying to find out exactly what the gut is doing is one of the critical parts of dealing with scleroderma.
Yeah, infections could just sit in the gut for a long time, for
Yes.
years. And you talked also about a thorough cardiovascular and pulmonary exam.
Yes.
Why should that be done?
Well, whenever you're talking about the biggest problem with scleroderma is the lungs. So that's where it becomes dangerous, is if it gets into the lungs. So trying to find out whether there is any type of problems with the lungs needs to be thoroughly looked at. If it's in the heart, it can cause cardiomyopathy. It can cause congestive heart failure. In the kidneys, you need to look at that real carefully. Circulation, doing a thorough diagnostics on the circulation, because if it's starting to affect the arteries, then that can play a very big role on how the body is working. As I said before, Raynaud's disease, which I find quite often within our practice, is something that it goes along with scleroderma of the back, neck. And so people are coming in for neck and low back pains, and they said, well, whenever I go out in the cold, my fingers turn blue or black.
So what's going through your mind as they're telling you that?
Well, then it's telling me that this isn't just a musculoskeletal problem, but it's also an autoimmune disease. So this is something that you're not just going to fix just by looking at the structural part, but you also have to look at the function.
Interesting.
That's why, we didn't, in our office, just decide to become structural, because there were so many different types of things that were involved functionally that are actually causing the structural problems. So having that awareness really helps us to be much more thorough, and our results improve quite dramatically.
Yeah, it makes sense. So are there any medications or vaccines for scleroderma?
No. Unfortunately, at this point, the ability to treat scleroderma pharmaceutically or coming up with a vaccine for it at this point is something that they're still working on. And the results of pharmaceuticals have been actually usually counterproductive.
It's interesting. So there is an ICD-10. There's a diagnostic code for scleroderma.
There is.
But do you see it coming, when people coming into your door?
With scleroderma? No.
Yeah, no. Okay. But you're finding it quite a bit.
But we're finding it quite a bit.
Okay, well, when we come back, let's talk about how effective structure function care is for scleroderma. Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. Dr. Prather, what is diathermy?
The way that we like to describe it to people is it's a large coiled magnet that produces a shortwave beam that goes into the body. Men with prostate infections, prostatitis, get up and say, oh, wow, I'm not in pain anymore, or I don't have that irritation. So in chronic types of, different types of infections, sinus infections, ear infections, lung infections, for the bladder infections, kidney infections, we can utilize it on that. One of the things that is really, really important for diathermy and underutilized is increasing the circulation. And we've had patients who were scheduled to have amputations of toes, even feet, because of the loss of circulation due to diabetic neuropathy. And we were able to have a series of diathermy treatments, usually about 24. If you set up the diathermy, have the right settings, which we know and understand, you don't have to go through the amputations that are involved. And that's one thing that isn't put out there as it should be, which was very frustrating. It's just like this gentleman said, I was scheduled to have my foot cut off. And 24 sessions with the diathermy, and the vascular surgeon says, I've got better circulation than he did.
Did he tell him about the diathermy unit?
He did. And the guy said, well, I'd never heard of that before. That would be effective. And that was one of the old things that the diathermy unit was used for, was for the diabetic neuropathy with the loss of circulation down into the feet. So if someone's scheduled to have their toes cut off or foot cut off, the diathermy is something that definitely should be looked at. It's been effective on everyone so far.
And you talked about 24 sessions, but when you look at different patients, the amount of sessions would be different for different issues that they have, correct?
It can be. Otitis media, you see an immediate difference just that day. Matter of fact, the people with loss of circulation can tell a big difference right away. He says, "Well, I've got pink toes now. I haven't had pink toes in a long time." And not only just for the circulation, but for those who have diabetic neuropathy, the diathermy is extremely, extremely beneficial.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope.
Don't stop believing.
You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where our mission is restoring hope to our patients. We're talking today about scleroderma. It is Scleroderma Awareness Month. And Dr. Prather, we're talking about treatment because there isn't any medications or vaccines for scleroderma. And we do what the FDA calls structure function care in our practice. How effective is it for scleroderma, the structure function model?
Well, the structure function model is always the way that should be. Everyone who has scleroderma should have structure function care, because really to be able to extend the life and for the real serious cases and to get the treatments that are necessary, because again, we don't really have pharmaceuticals that are effective, and then we also don't have surgeries are completely counterproductive in scleroderma. So structure function is really the best approach for this particular problem.
Now, are there supplements that have been shown effective for it?
There are. There's been research on supplements. As a matter of fact, Supplementation is for the systemic scleroderma, where people's lives are threatened. The supplementation has been really one of the only ways that we've seen some increase in lifespan. So, and one of the best things is a para-aminobenzoic acid, PABA, is...
PABA for short.
PABA for short. But certain forms of that have been very well documented to extend the life of a severe scleroderma patient. Matter of fact, one of the very few things that actually work. So para-aminobenzoic acid works quite well. Some of the omega-6 oils, vitamin E, if it's supported in the right way. Gotu kola is very effective for scleroderma.
Now, what is Gotu kola? Is it
that's an herbal.
An herbal, okay.
Yeah, but it also softens. It's also well known to help with atherosclerosis too. So it's a softening type of an agent that works extremely well, and it really helps out both with the localized and the systemic, just to slow down the process of the hardening.
Now, you said vitamin E, which is interesting because anytime we got a little burn, my dad would open a vitamin E capsule and put it on our skin.
Sure, because it really helps out with especially free radical pathology. So it cuts down a lot on the scar tissue formation. So it's something that's very helpful along those lines. And then bromelain. But one of the ways that you're really looking at supplementation is trying to improve the immune system.
Okay, to build the immune system up.
Yeah, understanding the process of, when you're talking about the approach between disease care, which is the normal medical model that people are aware of, and then structure function care is our approach. One of the big differentiations is our approach to autoimmune diseases. For the disease care, they really don't have anything to build the immune system that's effective. You have to support the body instead of giving it a pharmaceutical, which is a poison, to actually increase the immune system. So you have to approach it from a supportive type of a way. And the disease care, what they do is, well, we have the immune system attacking the body, so let's just destroy the immune system. And then you don't have the attack on the body. The problem with that is the whole reason that the immune system is attacking the body is because of failure of the immune system, so you're going to even weaken it more.
Right.
You actually have two different forms of the immune system. You have, in simple, I'm not going to get technical here, so I'm going to simplify it quite a bit. There's an outer immune system and there's an inner immune system. The outer immune system is to protect against foreign invaders. The inner immune system is to deal with damage in the body. So what occurs is the outer immune system fails, and the inner immune system is called on to, because it's more protected, it doesn't have the collapse like the outer immune system. So it's called on to do the defense of the body, and it doesn't do a very good job. It's not very good at differentiating. It's doing something it's not designed to do. And so when there's a trauma to a tendon or a ligament or skin, the inner immune system sits there and says, I don't know if that's a disease or what, but there's some damage here, so we're just going to attack it. And then you start to get, when it does that, then you get collagen that's laid down, and there's a thickening and a tightening of the connective tissue.
Interesting.
So what we do in the structure function care is we sit there and say, okay, we have a damaged immune system. Let's fix the immune system. And then the outer immune system is able to do its job. The inner immune system can do its job. And the body stops attacking itself.
So you're working on internally that immune system.
What we're doing is we're rebuilding the immune system, because if the immune system's working correctly, you do not have autoimmune disease. Now, is there a time where you don't want to do that? Well, there are. There are times where you have transplants, In other words, there are times to weaken the immune system and approach it from that standpoint.
Right.
But the majority, 80% of the time you're dealing with an autoimmune disease, the best way to approach that is to rebuild the immune system, and you get the best long-lasting, life-saving type of results with that.
And are people walking around with low immune systems and don't even know it?
Most
They're
people
just going through day to day.
It's very seldom that we find someone that has a real healthy immune system when they come into our office.
Really?
Most people have compromised immune systems, and rebuilding that is always something that we're looking to do within our office. And, it's something that everyone should be working on.
Right.
Should be consciously working, because we're doing a tremendous amount to damage our immune system with our diet, with the environmental exposure, the amount of toxins and environmental poisons that we get into our system. It's estimated that they are something like 40 times greater than with our great-grandparents.
Wow. Than our great-grandparents, which wasn't that long ago.
Wasn't that long ago.
So the toxins in our environment, you're
Sure.
saying 40 times.
Yes, the hormonal levels are switching because we have a tremendous amount of hormonal environmental chemicals that we're being exposed to. So people are having more difficulty with their hormones. Infertility is increasing quite dramatically because of that. So there's an assault on our system that is not just evident in humans, but is also evident in the animal kingdom too. They're documenting a tremendous amount of changes and toxicities that are causing hormonal and immune systems throughout the entire environment. So this is something that needs to be worked on by everyone just to keep their own system. We also need to be aware of that ecologically, that we're starting to try to reverse some of these things as a society. And unfortunately, our society is one that is poison dominated, and the amount of pharmaceuticals that people are taking in, and pharmaceuticals destroy the immune system, and there is not one pharmaceutical that does not weaken the immune system.
So if people are on pharmaceuticals, they really need to build their immune system.
They need to be constantly working on their immune system, because the pharmaceuticals are dramatically, and I'm saying dramatically, changing the effectiveness of the immune system.
Interesting. So what about diet? We talked about some supplementation.
Certainly.
That helps. What about what people are eating?
Well, one of the big things is if we can increase fiber. Fiber just does wonders for autoimmune diseases.
Yeah.
So we need to, we used to take in a tremendous amount of fiber into our diet and very little sugar. Now we bring in a tremendous amount of sugar into our diet and very little fiber.
We were talking, I was out with the girls last night, and one has a father's in their 90s and wasn't eating, and so the family brought in Ensure, and the first ingredient on there is sugar.
Sure.
He got very severely constipated, so I can see where fiber is so important, and people don't think about fiber in their diet.
No, and one of the things is anytime that anything is processed, the first thing they do is take out fiber. That's what the processing is.
Really?
So, whenever you're talking about any type of processed foods, you've lost the fiber. So really concentrating on that can do a tremendous amount for our health and well-being. Most people are going to need to have supplementation to accomplish it, and it's very rare to be able to accomplish that through just diet alone. What you would basically have to do is to grow your own food and then be an expert on soil management and get the minerals and nutrients into the soil, because our soil is also very depleted. So not only if you're even eating right, the soil quality from the 1930s to the soil quality today, because all the soil has been hit with so many different types of chemicals, the soil is also a living organism, and most of the soil is not alive anymore.
But it's, we're seeing more organic food.
There is an awareness. People have realized kind of what's going on and trying to reverse that.
Well, Dr. Prather, we have just a few seconds. How would you like to conclude?
Again, I feel that everybody should have a structure function doctor that's keeping up on their health, whether they have serious diseases or not. Mm-hmm. Because you want prevention is worth a pound. 1 ounce of prevention is worth a pound of cure.
Very good. Thank you, Dr. Prather, as always.
Thank you, Lisa.
The Prather practice is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather. Are you frustrated by not getting to the root cause of your health issue? Are you tired of not knowing why you're always fatigued? Are you wanting to say no to toxic drugs? Have you lost hope? Are you just tired of being sick and tired? At the Prather Practice, we want you to know that we have the answers for you. We offer the alternative to the disease care model. We are the drug-free model to health and wellness. At the Prather Practice, we look for the underlying cause of your health problem and not just the symptomatology. Through thorough diagnostics, we find your individual health blueprint for your treatment. Where the disease care model is symptom-based, the structure-function model we practice gets to the root of your health issue. The Prather Practice is the most comprehensive wellness center in the Midwest. Our integrated practice offers you the most treatment options to restore your health and your hope. Learn more about the Prather Practice by calling 317-848-8048 or learn more on our website at thevoiceofhealthradio.com.